Hello, I'm Dr. Jishamary. We are going to discuss the principles and art of cure by homeopathy by H.A. Roberts. We have already seen in part 1, the 13th page of the first chapter, what has homeopathy to offer the young man. This is about homeopathic philosophy. This is for the homeopathic students and for the practitioners. This is a tutorial video, and the common people, if you are interested to know more about homeopathy, you can also utilize this. So I'm going through the book. This is the book, The Principles and Art of Cure by Homeopathy. I'm going to explain sentence by sentence for getting efficient knowledge about the homeopathic philosophy which has written here, right? Okay, so 14th page, first para, one of the first essentials that we have discussed earlier. The next, homeopathy is founded upon principles that are in turn founded upon natural laws. See, homeopathy is built upon a lot of natural laws, and that natural laws, how it is, homeopathy is founded upon natural laws. It is as basic and eternal as hills. It is eternal as hills. However, the hills are there, the hills are stable. Homeopathic principles are very, very stable like that of hills, right? More natural laws were formulated before the hills came into being. If a man follows the in homeopathy leads, he must be able to follow these laws. If the student or doctor wants to follow up homeopathy, he has to follow up these basic principles of homeopathy and to hold close to them regardless of the pressure of influence. Pressure of influence means when we study homeopathy, when we practice homeopathy, lot of influences will come. Some may advise us to use patent medicines, and some may advise us to lead a lazy life while practicing as a homeopath. Some may influence us to manipulate the case for the financial advantage. So many kinds of influences will be there while we are starting homeopathic practice. So all these influences should not be coming into your mind, because you are a true student, true homeopathic doctor who is following the basic principles of homeopathy. You should have to maintain your stability. Stability of character must have with it. We have to maintain that stability, and equal measure the quality of patience. We should have the quality of patience. For what? In ordinary medicine, the quality of patience seemingly is not necessary. When a case is coming to allopathic practice, the doctor is asking about the disease, just writing the medicine, and at the end of the case, we are telling that uh, what all things we are possible we have done for the case, and what has happened is it is a misfortune of the patient. But in homeopathy, we cannot say it like that. We have to work for the case, and we should have the ability to say do this or don't do this. We have to stop the treatment. We have to stop the treatment if the patient is not feeling well, and if we are not able to raise the vital force of the patient, we should have the ability to stop the treatment at the same time. So we should be able to control the treatment according to the basic principles. So that stability maintaining is not at all very easy. In extreme cases where things have taken an undesirable course, the physician comforts himself that everything possible has been done for the patient, that we have already discussed. In homeopathy, one of our greatest axioms is when in doubt, don't. In homeopathy, if you are having a doubt, please stop it. The homeopathic physician must be able to plan his course, and once having determined upon it, to stick to it until it finds good reason for changing his course. If you are given a simillimum to a case of disease, you have taken the case well and can have given a simillimum. But if the disease is of uh, a deep with a deep psoric background, that medicine may aggravate and it may worsen the case. In that cases, sometimes we have to change the medicine, sometimes we have to stop our treatment, we have to work for the safety of the patient. Sometimes you have to put the patient in placebo. At that time, we have to make sure that the patient is comfortable, and we have to give that kind of comfort to the patient by taking our medicine. That kind of thing should be done. Okay. In that way, we have to plan the course of treatment, whether to stop, whether to start, where to give the complementary medicine, where we have to antidote. All things we should have to know. The man who considers homeopathy as possible future must be student of people. Then the next thing, we should be student of people. See, so many things we are studying in our medical homeopathic medical colleges. So many textbooks are studying. We are studying a lot many things, but the patients before us are the real experts. They will say lot many symptoms, then we have to understand lot many things. The patient will teach so many things, so we have to we have to be we have to be ready to study the people. We are those who are coming before us, and willing to become a student of philosophy. We should have to follow the principles. We have to study it and follow it. He must be able to read between the true and false in any symptoms the patient may give. We have to scrutinize the symptoms the patient may give. What symptom has to take? What symptoms have to take? What symptoms has to be avoided? He must be able to read between the true and the false in any symptoms the patient may give. We have to scrutinize the symptoms of the patient whether it is true or false. He must train himself to observe all the signs. If the vital force, according to homeopathy, the patient will be showing a lot many symptoms. If the vital force is diseased or the person is diseased, that signs and symptoms should be observed and collected. Human face, and he must be able to interpret all the signs which show through habits and circumstances. And also we should be very much careful about the social or familiar circumstances and habits of the patient into indications for the health restoring medicines. And that's how we are reaching to the minimum or health restoring medicines, which has to be at his command. Hours must be spent in patient study. See, it's not very easy to take a case. It may take an hour or so many hours. We have to write or sit patiently with the patient, and it's not an easy thing. Tracing the cause of the disturbance and the remedy to fit it. When this case started, and when it started, what was the progress, what medicines he has taken, and what is the current situation, what are the medicines he is now taking. All these things should be collected, and the remedy to fit it. And we have to find out a simple single medicine which is fit to the case before us, always basing the process upon the sound rock of natural, and it should be based on the natural laws of homeopathy. To the young man who is equipped and willing to undergo the training of his lifelong task, this is a lifelong process. If you are studying your first case and second case will come, the second case will be entirely different from that of the first one. You are going through the case, and you are doing this, and based on principles you are applying according to the art of homeopathy, and you are getting lot many cases. All these things are going on till the end of your life. This is a lifelong task. If you are practicing the same, homeopathy has everything to offer. Homeopathy will offer everything for one who practices this natural laws and taking care of all these things. Those who are ready to do this lifelong task, homeopathy has everything to offer. So these are the all things we have discussed in page number 14. I think it's clear. And if you are feeling this video is useful to you in order to study this HA robots, the homeopathic philosophy, you just share this video with your friends and relatives. And thanks for watching. I'll come with a follow-up of the same chapter in the next video. Thanks for watching. Signing off, Dr. Jishamary.